Okay, well, let's go ahead and get started to be respectful of everyone's time. Am I on speaker? I am? I have to project? Do I have to use my outside voice? It's on. Testing 1, 2, 3, testing 1, 2, 3. Here we go. All right, let's go ahead and get started to be respectful of everyone's time. I understand we do have a quorum. Commissioner Gonzalez, you're on remotely, is that correct?
Oh, turn that on.
I think that's an affirmative. Thank you, sir. Okay. Well, let's go ahead and begin the meeting of the El Paso County Public Health Board of Health, August 26th. And I'm going to make a public health decision right up front that those of us who are behind the screen, we don't have to wear a mask, okay? Doris, if you want to take that off, that's fine. But if we're in our plexiglass shielded partitions, I think it's just fine, and it'll make it a little easier also. First up is approval of the agenda. Board members, you have that in your packet. I hope you've had a chance to look at it. Any discussion, questions? If not, I need a motion to approve. Second? Second. All in favor?
Aye.
Okay. Board of Health comments. I have a couple. I've had the opportunity to attend a NACHO, National Association of City and County Health Officers Preparedness Conference this week, virtually, of course. And this is an annual event that includes a lot of government agencies, a lot of government health agencies, specifically Health and Human Services, Centers for Medicaid and Medicare, and also ASPR, Assistant Secretary of Preparedness and Response, and DHS as well. So yesterday I had the chance to listen in on the Department of Homeland Security presentation, and just a couple of observations from that. One of which is that it looks like just-in-time supply for pandemics doesn't work. And the analogy from that is that public health just in time doesn't work. It's very difficult to ramp up sufficiently in a short amount of time to encounter one of these fast-moving public health crises. And so the resolution from that was that we need to have a fully functional, robust, staffed, funded health departments across the nation. And the segue on that is that health security is part of national security. The number one function of our national government is safety of its citizens, and I would include health and safety. So we in public health are part of a bigger team. And our partnerships with public safety, and I'll include in that fire, police, EMS, and now our first-line medical responders in emergency rooms, those are our partners. So we in public health collaborate with public safety, and we are now also a first responder. So that may seem like a lot of words to convey what is probably a very simple point, but I like to think about inclusion, I like to think about partnerships, I like to think about collaboration. And that particular talk from Department of Homeland Security impressed me. So, Board of Health member comments, please. Yeah.
Doris, I'd like to just say
Can you please unmute your mic?
You have to turn it up, kind of point it at your face, at your mouth. There you go.
Okay, thank you. I always get confused about this, thinking my voice is louder than it is. And then also, we do have our health department has a lot of collaborations and partnerships, and I think we're probably a leader in that way. And again, thank you for that, because it does take many partners and collaborators to make our community safer and healthier. So thank you.
Any other Board of Health member comments? Yes. Commissioner Bremer.
Thank you. To follow on the previous two comments as well, I've said it many times before, but I'm not sure in this particular venue, that our health department was positioned and ready to perform for such a time as this, and that's kudos to every single one of the staff members of the health department as well as the leadership. And so you're right, Dr. Turbish, that just in time does not work for a pandemic, and we had leadership that had the foresight to have us positioned to be able to quickly scale up and provide for this community. And I think probably a way that very few communities across the nation have been able to do so. So looking forward to continue to seeing El Paso County and El Paso County Health Department be a leader in the way that we can do that. And then also, I just wanted to give a huge shout out to the entire team who has been working super closely with our school boards and schools and school districts to ensure that that children can get back to education safely, put together plans that work for individual schools. They're all a little different. And I am the proud mom of a kindergartner who started last week, and it's really phenomenal to see really the steps and the behind-the-scenes work that administrators and teachers had to put in place to ensure the safety of all the staff in the school, as well as the safety and well-being of the kids. It's been super exciting to see that play out in action, and to also hear directly from school staff that they feel like they've had a direct line to the health department and good guidance in developing their plan. So I know that doesn't just happen. That's part of the positioning thing. So I'm looking forward to hearing, I think, later in our COVID-19 update later a little more about those school plans. But huge kudos, and I do feel like I am safely sending a high-risk kindergartner to kindergarten in person.
That's great news. Board of Health member Kari. Yes, please, and we can be without masks in the partitions.
Sorry I was late. Thank you very much. I just wanted to let the board know that I spoke with the members of the CHN, Colorado Health Network, it used to be SCAP, and you might all be already aware that the state legislator passed a law that allows syringe access programs in communities to proceed without Board of Health approval, and that they're moving forward with that. They expect to have a full plan by the end of this year, and then they'd like to come and talk to us about it the beginning of 2021. In the meantime, though, they were very open to partnering with the Health Department, Board of Health in any way. They're open to conversation, comments, suggestions. So I'd be happy to pass along contact information if anyone would like to meet with them. And I think they might be reaching out to members of the board as well. So just wanted to update everyone on that.
Thanks, Kari, for the update. Okay, any other Board of Health member comments?
Gonzalez?
Oh, Longinos, excuse me. Commissioner Gonzalez, yes, sir.
Oh, yeah, a couple of things. So I have been getting some calls and emails regarding the back to school. I know with the various school districts that we have that most of them are doing something different, and there's some confusion on whether those are done independently of the school districts or mandates from the county public health, and so I just want to make sure that
Commissioner Gonzalez, we're going to need some help. Maybe it's just me, but if you can turn up the volume in here, okay? Maybe you could recap that first couple of sentences and go again because it was somewhat muffled, sir.
Okay, regarding the back to school, I'm getting emails from parents who are confused on whether those are school mandates or mandates from public health. So it might be nice if they're not already posted, that whatever our recommendations to the school districts were be posted, so it's easier for the parents to address that. I believe we put out recommendations and not any mandates, and I just want to clarify whether those were mandates or recommendations. I'm pretty sure I know they're recommendations, but I want to be able to make sure the parents can see where that information is. A couple other things. I'll reserve comments about the COVID. I know we're doing better and looking at variances again in terms of should we be going back to our higher levels, perhaps after this week if our numbers stay low, but I'm sure that'll come up later again. And then regarding the Colorado Health Network and the drug syringe exchange, needle exchange, they did that law to take the local control away from us. It does still mandate that they do a stakeholder meeting that requires law enforcement, public, and the district attorney's office. I want to make sure that meeting is publicized so that our public and I and others from public health and Board of Health can participate. Thank you.
Thank you. Noted, and your comments will be part of the record. Let's figure out really who is out there. This whole disembodied voice thing has got me going. Board of Health member Sam Geek, are you out there?
Yes, I am, sir.
Great. Good to hear from you. And Councilwoman Yolanda Avila, are you out there?
Yes, I am.
Excellent. Okay. And Vicki Broman. Not yet. I'm hoping she'll join us. And that's everybody. That accounts for the Board of Health members. Okay. Next is approval of the minutes from our last meeting, July 22nd. And also August 13th. So we've had 2 meetings, and the minutes are available to board members. Have you had a chance to look them over? Any discussion or questions? We're good? Okay, I need a motion to approve the minutes.
I'll move to approve.
All in favor?
Aye.
Aye.
Okay. Nikki Simmons. We have 2 items. You're going to give us a financial summary, and then we actually have a resolution to read and hopefully approve. Nikki.
Members, good morning, Board of Health members. Nikki Simmons, County Controller. Here today to present to you your July 2020 financial report. Very similar numbers to last month. Obviously, the focus of operations has changed significantly since adopting the budget back last December. So far, year to date, the Public Health Department has brought in $11.4 million and expended just over 10.4. So at this point, we actually have added to the fund balance. That being said, we are billing less in certain areas, but then have federal funding streams to cover most everything that we're doing related to COVID. I wanted to point out on this, there are 2 lines, the federal COVID-19 amount. So far, public health has expended $507,000 of the CARES allocation that is coming through the county. So that is county pass through to the Public Health Department, as well as $652,970 from the state pass-through amounts. So there are 2 different CARES Act allocations coming to El Paso County Public Health. So with this budget is based on what was initially approved. The next thing we'll be talking about is a resolution to actually amend the budget, so that way we start looking at how much of the CARES money has actually been spent compared to the actual budget as we continue to focus on that. So unless there's any other questions, that's all I had for this report. And I don't know if we need a separate vote on this one. I think we do.
Okay. Let's go ahead, Board of Health members. Let's, any discussion about Nikki's report so far? And I think we'll call that the July summary. Okay. And
I'll move to approve pending audit.
move to approve pending audit. Second?
Second.
All in favor?
Aye.
Aye.
Great. Thank you. All right. Now you have a second report for us, Nikki?
Yes.
Okay.
Okay, so in your packet is a resolution to recognize revenue and appropriate expenditures in the amount of $4.9 million for the CARES Act. This is coming from two separate areas. If you recall on the previous slide, there was $652,970 that came from Colorado Department of Public Health and Environment, as well as other amounts that had been spent so far from the allocation that the county gave El Paso County Public Health. The total of that amount is $4.3 million. So the two combined make up this $4.952 million. All of that has to be spent in 2020. So we are asking to recognize it and appropriate it all into the 2020 public health budget. Which will allow the flexibility to be able to respond appropriately to all the coronavirus needs. So.
Resolution. Any discussion on this CARES Act supplement? Yes, Victoria.
Nikki, I just wanted one point of clarification on the resolution when I read over it last night. It talks about the recognized revenue of was it 4.9 and some change? Mm-hmm. And then underneath there it says other professional services, and it's not an additional, it's accounting for all of the funds, right. Correct?
Right. So the top two lines are split because it's the two revenue lines that we're putting it into, and then the next part is actually appropriating the expenditures. So we recognize the revenue, and then the second part is putting it into the actual expense budget. Okay. So it puts it in the top and the bottom, so you see it as revenue and expense.
Thank you. I just want to make sure we had that clear.
Mm-hmm. Kari, did you have a question? No? Any other board member questions? Commissioner Gonzalez? Any questions for Nikki?
Nope, I'm good.
Sam, you okay?
Yes, sir, I'm fine, thank you.
All right. All right, this is quite a lengthy resolution and a lot of numbers. So I will read it into the record. I may not hit every number, but that it is part of the public record and it'll be admitted. Okay, and then we can vote. All right, resolution subject, resolution to recognize revenue and appropriate expenditures in the amount of $4,952,970 for the Coronavirus Aid, Relief, and Economic Security Act, which I will refer to as CARES from here on out. Effective today. Resolution of the El Paso County Board of Health. Whereas, as a result of the COVID-19 global pandemic, the Coronavirus CARES Act was passed by Congress and signed into law by the President on March 27th to provide fast and direct economic assistance from the U.S. Department of Treasury through the Coronavirus Relief Fund to state, local, and tribal governments navigating the impact of the COVID-19 outbreak. And whereas grant funds for the CARES Act were provided to El Paso County, of which $4,300,000 was shared back to the El Paso County Department of Public Health to cover necessary expenditures incurred due to the public health emergency with respect to COVID-19 from March 1st through December 30th, 2020, that were not previously accounted for in the budget, most recently approved for El Paso County Public Health. And whereas additional CARES Act funds in the amount of $652,970 were passed through the Colorado Department of Public Health and Environment, referred to as CDPHE here, to the El Paso County Department of Public Health to aid with the expenditures incurred due to the public health emergency with respect to COVID-19 from March 1st to December 30th that were not previously accounted for in the budget most recently approved. Now, therefore, be it resolved that the El Paso County Board of Health does hereby recognize revenue and appropriate expenditures in the amount of $4,952,970 to the El Paso County Department of Public Health 2020 budget in the following manner. And Nikki, you had detailed that for us. I won't read that chart. And other professional services, appropriate expenditures to the tune of $4,952,970. Done this day, 26th day of August at Colorado Springs. And discussion, Board of Health member discussions. This seems to be an accounting for money we've already received and expenditures we've already expended. So
Or will expend over the next 5
tidying things
months.
up, is that correct? Okay. And provides us some additional opportunity. Board of Health member comments, questions? Okay. I need a motion and a second, and we'll approve the resolution.
I will move approval of this resolution.
All in favor?
Aye.
Any opposed? Okay, it's passed.
Thank you.
Good job, Nikki. Thank you. Oh, thank you very much for doing that. Keep us healthy. Okay, next on the agenda, something I've been looking forward to is the RISE Coalition report. And Susan, are you going to make do you want to introduce these fine people or have them introduce themselves?
Sure. I think you all are aware that we've been working with numerous partners, as Doris had mentioned earlier, and El Palmar is one of them, and also the RISE Coalition. So I'm really happy that Kathy from El Palmar has been able to join us today with some of her fellows, and also Joy Salzar, who is a member of our team as well. And they have a report that we've just completed, and we would like to present on that and all of the good work that goes on with public health. COVID is dominating. However, there are efforts that still continue that the pandemic has exasperated, and so this report will get into some of that. So thank you, Kathy Robbins, for being here today.
And thank you, Susan, for inviting us to present a brief presentation about the RISE Coalition and our work. I also would like to acknowledge and thank board member and city council member Avila as a founding member, resident leader of the RISE Coalition. So Yolanda, I know you can hear me, so thank you very much for all your efforts for the RISE Coalition. The vision of the RISE Coalition is a connected, dynamic community that provides opportunities for all. And the methods through which they achieve that vision, I'm advancing a slide because I need reminders to do that, so excuse me for that little lapse. So that vision of a connected, vibrant community is holistic, and you can see from the slide the 5 areas in which the coalition is focused. The method, or the how that they get to that vision, is change through resident-led involvement. So the key components of this is thriving communities led by residents, the people who work, live, and play there. 5 years ago, the trustees of El Palmar Foundation made a decision to invest in the future of Southeast Colorado Springs. And they did that through a multi-year grant, and El Paso County Public Health was selected in a competitive process to receive that grant to lead this effort. We are now in the 4th year of that grant, and the timing seemed right to take a look at where we've been, what we have accomplished, and what's left to do. So this report summarizes our findings, and you're going to hear from various members of the team about their part in this process. So I would now like to invite Janie Conrad to the podium.
Thank you, Kathy, and thank you everyone for having us today. So we knew and believed that the RISE Coalition has a really deep impact on the community, and you can see that across various levels in which they affect the people around them. So as we looked to collect our data, we thought about how to do that and what would be the best approach. We settled on a 3-tier approach in which we were collecting data from primary partners through interviews, secondary partners through focus groups, and then tertiary partners in a survey. Of course, we decided this in January 2020, and then, thank you, Kathy. And then, of course, had to rapidly change our approach. So the focus groups no longer happened, as it didn't seem appropriate or feasible to collect data on that level in large groups. So we chose instead to increase the number of interviews that we conducted and increase the number of surveys that we asked folks to fill out. To inform the questions that we asked in each of those methods, we met with the RISE Advisory Board. And we tried to discuss, and we discussed the strengths, areas for improvement, and future visions for the coalition. We then synthesized and took away the key takeaways from that meeting and used that to inform the questions that we asked each of those stakeholders. We then conducted just about 20 interviews with 22 participants. If participants represented the same organization, we interviewed them together, and then collected just around 40 surveys. With that information, we dug through it, we looked at what we thought were commonalities, trends, and themes, and then used that to inform our findings, which Kayla will present to us today. Thank you.
Thank you, Janie. What we found in our report was what was possible because of RISE. Many respondents expressed their gratitude, excitement, and passion for the community-led effort by the coalition. This is one of my favorite visualizations because it shows how important the connections that have been formed by RISE will continue to be formed and will also deepen due to their work. These quotes are the narrative for our findings. To us, it became increasingly clear the true value RISE has not only to the Southeast Colorado Springs community, but the entire city. And you can see some of those ways named here on this slide. Southeast not only needed a voice, but they needed a table to sit at. As one resident put it, the RISE Coalition brought the tables and the chairs. As a neutral convener, residents and organizations were able to find a trusted space to share ideas and collaborate within. With no ulterior motive, RISE provides access to community organizing and change in one place. Partner organizations explained how RISE creates an efficient, effective, and honest connection to the community that would otherwise take extensive time and resources to establish. This is visible in a multitude of projects, from the Panorama Park revitalization or the community hub at the Mission Trace Shopping Center, in which RISE was able to solicit community voice, leverage funding, and provide a space to share ideas. As RISE moves forward, it will also be important to recognize the issues that still face Southeast Colorado Springs. And for us, they came down into 6 categories. So infrastructure, think transportation or affordable housing, access, whether that's to quality jobs or healthcare, health, so stressors on our youth, or just general disparities in access to healthcare, economy, so economic development for small businesses in the area, but also on the flip side, the threat of gentrification and displacement of those residents. Community, so engagement or education on what's going on in Southeast, and then another category that encapsulated like stigma for the community or higher incarceration rates for that part of the city. And while they are 6 separate categories, they all fall under the social determinants of health. And it will take full community involvement to tackle these problems. And RISE will be a valuable asset in bringing together various organizations and stakeholders into that mix. Our research also presented no clear permanent home for RISE, but it was very visible to our team that RISE is too valuable to go away. It's clear to community partners and resident leaders still find valuable value in RISE, and noted its importance in community development in Southeast, its value in raising community voice and engagement, and just also how much work there's still left to do in Southeast. Our voices made it clear that there is a chance to mobilize Southeast, finish the projects that are underway, and chart a path forward that looked at these challenges as opportunities to bring the community even closer together and create a healthier, safer Colorado Springs. I will now pass it off to Joyce Salazar, who will share the recommendations in the report that were made to chart this path forward.
Good morning. My name is Joyce Salazar, and as my name is Joyce Salazar, and as Susan Whelan said, I am a part of public health. I am the Community Outreach Coordinator for the RISE Coalition in Southeast Colorado Springs. I not only work in Southeast, but I live in Southeast. So I've lived in the community for over 30 years. So I have lived experience and I have professional experience in the community and in this work. And so as we talk about all of the things that have happened in Southeast, which are pretty amazing, specifically yesterday, City Council approved the $9 million park project for the renovation of Panorama Park, with RISE leading the way. Not only our residents, but our coalition partners, but at the forefront was the voice of the community. So I'm proud to stand here and represent the community and public health in this effort. Recommendations for the RISE Coalition were very interesting because our resident leaders were hoping to see the next steps forward. However, the assessment really showed us our strengths, and it showed us areas that we could improve on. And since 2017, we, RISE, and the resident leaders have been working together to promote our partners, their programs, their projects, and we've failed to really strengthen the infrastructure of RISE. And so the recommendations of this assessment are to strengthen leadership, create bylaws, create a stronger board for the coalition. Our coalition members want a clear path to what's next. So our short-term recommendations are leadership training. They are really establishing a strong board and then creating those bylaws for the board. And our long-term recommendations are really a strategic plan on how we move forward together as RISE, not only to enhance Southeast, but also to connect more with the city of Colorado Springs and enhance the city as a whole. And in doing that, we do need a strategic plan. We do need to think about policies that really not only strengthen Southeast, but strengthen the whole city and the county as well. So thank you very much for the invitation to present. And if you have any questions, I'm sure you can find my number very quickly. So thank you.
Thank you very much. We'll go for, first though, I would like to ask Councilwoman Avila, who's been very involved with this. Do you have any comments about this program, please?
Are you able to hear me?
We can hear you.
Okay, great. Okay, so thank you so much for the presentation. It's been a process. I'm one of the original, I call them the original gangsters of RISE, myself and Joyce Salazar and Jeannie Orozco. I mean, this woman brought so much to the table. And what happened is there were 7 resident leaders and 6 partners, nonprofit. But the leaders really took it on. We knew that this had to be community driven. It had to be driven by, us who live there, who work there, who play there. And we did, each one of us, poured out our blood, sweat, and tears to be heard. I mean, we had not had a voice in Southeast Colorado Springs. But since the RISE Coalition and working with our partners and working with the county, it has been amazing because we have created, RISE Southeast comes out a lot, I know, during the Board of Health, but also in our city conversations here at City Council. And a lot of just this would not have happened. The work that's happening at Panorama Park or the hub at Mission Trace. And there's other projects going on that I'm not able to share at this time. And but we have suffered too. We've partnered, and a lot of us are included in what's called Transforming Safety and the Urban Land Institute. So it's a lot of the same leaders that have been made through this process. A lot of leaders have been made through this process that live in the district. And we do have a long way to go. And so, but I'm so appreciative that this was even started. And one story I always tell is that the Cinco de Mayo, they have an annual festival, and they had a festival like 3 years ago now at Pikes Peak Community College. And at its peak, 500 people showed up, and it was really kind of sad. And so the next year, RISE partnered with Cinco de Mayo and had the event at Mission Trace Center. And that's when the county health was having vaccines, and we were giving away backpacks. The mayor showed up, and it was just a celebration. And at its peak, there were 10,000 people there. And that was the power of letting the community drive the initiatives, because we know where the people are. We know where the interests are. We know what it is we need. So I am so grateful to everyone involved in this. We have a wonderful coordinator in Joyce Salazar, and in all the other participants of RISE. So thank you all. I look forward to the next phase.
Thank you very much. Other Board of Health member comments about RISE?
This is Commissioner Gonzalez.
Yes, we hear you.
Oh, thanks. I just wanted to thank Joyce and RISE Coalition. I've gotten to participate in a lot of their functions as well. Participated in numerous numbers of the Panorama Park project and the hub and the Transforming Safety as well. So that area of town where I live in is an area that RISE has done some great things, and I'm very supportive of all the efforts that they've done, and I'm very happy for our community.
Any other Board of Health member comments? Well, thank you very much for presenting today, and also for the strong work you do for Southeast and for the city of Colorado Springs. Thank you. All right. I think it's time for Director's Report. Public Health Director Susan Whelan, please.
Thank you. I have a few different updates, and before we jump into our COVID update, I'll start first with introducing our new Community Health Promotion Division Director, Kyle Unland. If you could come up, please. As you are aware, we have a lot of efforts in community health improvement, and as Councilwoman Avila just said, and I love this, public is where people live, work, play, and worship. And so this is a really big role that he serves in, and he is from Spokane, Washington, where he held a similar position with the Spokane Health District, and his background includes work on public health efforts related to obesity, substance use such as tobacco, marijuana, and injury prevention, as well as nutrition. And Kyle, welcome, and if you would like to say a few words to the Board of Health, that would be wonderful.
Great. Thank you, Susan. Members of the board, thank you for allowing me to be here. And I'm just really, truly blessed and honored to be in such a wonderful county, and to be able to help the citizens of the county and the communities achieve the goals and the objectives that they are setting out to achieve to ensure that they have a wonderful quality of life here within the county. And so my job is to help facilitate that process and facilitate and work for the citizens of the county and to ensure that we're able to achieve those things that we want to achieve to improve our quality of life. I'm honored to be with the health department, third day on the job, and I'm just really couldn't say enough as far as praise, as far as what I've been able to ascertain there in an environment that doesn't have a lot of people at the health district right now. So it's meeting people virtually and being engaged with reading a lot of materials and plans and looking at community plans. And the RISE Coalition is just a wonderful example of what a community can do with great leadership and a great participation from the community. Giving the community a voice is extremely valuable to achieving the health results that we would like to achieve. So my mission is to, again, help achieve those things for the county, El Paso County, and move forward and to really helping the citizens achieve the things they want to achieve. So thank you very much for allowing me to be here. I'm really honored and blessed and looking forward to meeting with each of you and talking about what we can achieve together. Thank you very much. Any questions at all?
Thank you, Kyle.
Thank you very much, Susan.
I wanted to give an accreditation update. If you all recall, we were the first health department in the state of Colorado and one of very few that achieved accreditation 5 years ago. And we have been steadily and slowly working on reaccreditation. And last week, Friday, we have resubmitted in some of the areas that we needed to. And with accreditation, that ensures that we are demonstrating meeting all measures to be an optimum local public health agency. And I look forward to the outcome of that. A lot of work goes into that with all team members in the agency, as well as partners that we have to demonstrate that we meet certain measures. So I will report back on that once I hear back from the accreditation board. So that's good news. Next topic that I would like to mention is that flu season is going to be here soon, and wanted to just plant some seeds about that because we will need to do a vaccination campaign with our partners, as well as promote flu vaccine. And so we, yesterday, spoke with our immunization program manager, Christy Durbin, as we were talking about points of dispensing as it relates to COVID, and asked her about our supplies, and we received 100 supplies yesterday. So I know that there are supplies of flu vaccine that are coming into our community, and we will promote flu vaccination and encourage folks to get their flu vaccinations starting in September. So more to come on that. I think that you all had received the announcement that we are working with Matthews VU to provide services for public health. It's an innovative partnership, as many of our staff, more than 50%, are reassigned to the COVID response and recovery. Therefore, we have had to suspend or stop some of our services, and we are grateful to Dr. Johnson for setting up a partnership with Matthews VU, for we are able to team up with them, and they are providing back-to-school vaccinations for us, and we'll continue to work on some of those efforts, but we are entering to a different season as well, and want folks to be aware of what actions that need to be taken on top of COVID prevention. We are working on a resiliency campaign. We knew when COVID, we had our first few cases that we were going to need resiliency resources not only for our staff but also for the entire community. And so we are currently working with Dr. Benight and partners, and they, UCCS, Aspen Point, as well as NAMI came to the Board of County Commissioners and provided a presentation. We will do the same presentation to the Board of Health next month to provide some more details about that and how we can build resiliency and strengthen resiliency in our community. So now getting into the COVID-19 update that we always provide in different areas. There's a lot of different moving parts as the COVID pandemic evolves. I did want to circle back with the budget and thank the Board of County Commissioners for making public health a priority when it comes to CARES dollars to ensure that we have what we need. It has been from the public health front, incredibly fast-moving, and we've been trying to build, areas of public health infrastructure in different many areas. But we have had and do have a solid core team, and you'll hear from some of those today, which is really the foundation for local public health, and they have been incredible. And thank you to the comments that Board of Health members have made, because I always say that you might not see them doing a presentation. However, they are steadily and hard at work 24/7, to protect the community. We are going to touch on schools updates K through 12 today with our lead epidemiologist, Haley Zachary. We will also walk through a data dashboard update to give us an update on the status, as well as some new features that we're working on in partnership with our hospitals. And we will also provide an update around our new testing site, which the Board of County Commissioners have helped fund, as well as the City of Colorado Springs. And that's a high-volume, low-barrier testing site in southeast Colorado Springs, and it's located at the Citadel Mall. So we'll have an update on that, and then we'll take questions on anything else that you would like us to address. Haley, would you like to come up, please?
Haley, do you have some slides? Okay.
So nice to see people in person. It's been quite a while.
It's been a while.
So good morning. My name is Haley Zachary, and I am the lead communicable disease epidemiologist, and I wanted to highlight some of the work that we've been doing with our schools here within the county. Really, our work with them has always existed. We work very closely with our school nurses in a lot of different capacities, but in regard to COVID, we started hearing a lot from them back in March, and that was primarily associated with children who had been traveling internationally and how to address those concerns within the school. And so it was back then that we started to really understand that it was going to be a lot of work and a long road in order to get them up and running with this new kind of state of the world. So at that time, we brought on a school liaison, and in addition to that, we dedicated a full-time communicable disease expert to that team. And then we got a bit of a reprieve when Polis went ahead and canceled in-person learning, so we had a little bit of time to kind of format a plan and get together. It was in May that we really started working very strongly with our Pikes Peak region superintendents, as well as our nursing group. And they are really the subject matter experts within schools. And so we were able to give them a lot of information from the public health side, but they were able to talk to us about implementation, the concerns that they may have had. And those aren't always at the forefront of our mind, which is what makes these partnerships so strong. It was in March as well that we were able to write and get approval for variances to host graduation, not only for students, but also allowance of their family members to attend. And so that was a great feat because that's definitely a milestone for a lot of our population. And in June is when we began a steering group committee, which was a 15+ member across the board, with representatives from OEM, communicable disease, environmental health, and other critical personnel, in order to really kind of make this a cohesive response and try and understand all angles of how we were going to deal with the reopening of schools. So in July, we began to definitely see an uptick of school nurses contacting us regarding cases within their schools and how to handle those. We also began participating on work groups with CDPHE to create a statewide surveillance system for schools to report baseline illnesses, and that should actually be coming on board here this week. It was in July that Dr. Kelly really took the initiative to write some localized school guidance on reopening, and I point that out because it wasn't until August that CDPHE went ahead and wrote theirs. So we were really at the forefront of that response, and I think we're very proud of that fact and that we were able to not only establish guidelines for here locally, but also for the state. In August, a lot of this work has really ramped up, and so CDPHE, we sat on work groups with them in order to create outbreak guidance as well as case guidance within schools, in addition to that more generalized guidance about how to deal with COVID within the school system. We hired an additional full-time epidemiologist to work with the schools specifically, so they are solely dedicated to that school response. And we were also able to create weekly office hours or a weekly meeting with school nursing groups so that we can talk to them about what their concerns are within the school and make sure that those individual questions are addressed. And we continue this process. It's obviously going to be ongoing. We are in the process of hiring a school nurse consultant specifically to talk about that technical areas of nursing within the school scenario, as well as hiring a full-time school liaison to help encourage those relationships and foster them through this process. So all of this is built on a foundation that all cases of COVID-19 are immediately reportable to the health department as our suspect outbreaks. And having this timely report helps us to enact control measures efficiently. And in doing so, we are able to reduce the spread of illness, protect the health of our students, our staff, and in turn, our community. So we really did create this local guidance in order to steer kind of our educational community about what is going on, and having that really directed guidance. And I heard Mr. Gonzalez talk about this guidance, and it is posted on our website, and it is also posted on the CDPHE website, and so people do have access to that. However, we have targeted that messaging towards our stakeholder communities and have created different sites where they can get that information in a cohesive package. And this is primarily how to deal with the generalized setting. So what processes we follow when there are confirmed or probable cases in schools, when they might want to think about things like closing, where to find more information, when we're talking about PPE, how to do that, and really kind of outlining some of those larger generalized questions that we've been hearing. We've worked with CDPHE to create exclusion algorithms, and these have been really fundamental in our response in that they really kind of line out the picture of when children need to stay home, same with staff, when you need to send someone home, also when they are allowed to come back. That's a big question that we get, and so really outlining not only when they need to leave, but when they are allowed to come back into school, and what to do with everyone else. That's also a big one. What do you do with the siblings of the sick kid? What do you do with the cohort? And so really kind of empowering the school nurses and the schools to identify these algorithms and really kind of work through them and arming them with that knowledge so that they can help us help them has really been a strong partnership. Every time we talk to schools, there's a very strong environmental health component, and we talk about disinfection and cleaning with them. We also give them recommendations for hand washing and use of hand sanitizing gels, as well as the best way to utilize respiratory hygiene and etiquette, and the importance of isolating ill individuals within the school. And all of this wouldn't matter if we didn't communicate any of it. So we've really worked hard to set up a good communication system. We've set up a school nurses Google Drive, which is essentially a repository of information where they can find templates linked to guidance. And we're also facilitating peer-to-peer communication so that things that are working for one school, that nurse can post that information and another school can benefit from that as well. And this is a very strong group. They are strong communicators, and they have certainly let us know their concerns, and through that we've been able to help them address them and find the best way forward. So we do host weekly meetings with them. Those are currently facilitated by the Communicable Disease Department, and really right now it's an open forum for them to address those questions and concerns. We've created a school inbox specifically for schools, not only the K through 12, but for higher ed, to be able to email a generalized mailbox, and then that is then facilitated to get to the best SME to get for rapid response to them. And then we've dedicated a team solely to dealing with schools. And so although that team is currently surging, we've really had some really strong focused information going to those schools with a very strong focused group. And so, although I get the pleasure of presenting this information, I really wanted to highlight Jenny Satry, Melissa Rogerson, Heather Tucker, Dr. Leon Kelly, as well as Susan Payne for really being the structure of this and seeing it all the way through. They were really there at the beginning, and so as I said, our team is currently surging, but it's really built on this strong foundation that they've built. So we are available to discuss schools not only during the day, but also 24/7, and we are happy to do it. So thank you very much for your time.
Thank you very much. Any questions for Haley? Yes, please, Vicki.
Hi, Haley. Thank you so much. And I really want to commend you and the whole staff of the health department. This is really, really a great overview for our schools. I'm impressed. I had two questions really quickly. One of the slides you talked about, the mandatory reporting. And from a school perspective, who's ultimately responsible for that? Is it the lab where they're tested? Is it only kids that are tested? Is it symptomology that is reported? Is it the school nurse, their private physician? Who's doing that reporting, and how are we making sure that there's not overlap or overcounting of those numbers?
Sure. So all confirmed, laboratory confirmed cases are reportable to the health department. And essentially, ultimately, the lab is probably the most frequent reporter of those. However, the physician does have the ability to call that in if they are concerned. We talked to the school nurses about the fact that it is mandatorily reportable. That being said, they're not necessarily that person who needs to report it. However, with that foundation, often there's a delay in lab results or a delay in communication, and sometimes they may be the first person to receive that information. And because we want to encourage that really quick response, we do encourage them to give us a call to report that so that we can enact those control measures efficiently. They will only be counted once, so they don't get recounted in the system if they get re-reported. Essentially, we have a very strong deduplication process, so if we do identify someone being reported more than once, we're able to delete those out of the system.
Great. And then with the algorithm, being a nurse, I live for algorithms. With the algorithm, is that kids that, or staff that are tested positive, confirmed positive, or that their symptoms represent a possible COVID and they're sent home? We're getting into flu season, and I think you know where I'm going. The symptomology is very similar. And so will all kids be treated that same way in staff?
Sure, and so they do kind of address both. I will say the algorithms are more complicated and take a little more maneuvering for those that are symptomatic without that diagnosis. And so for the sake of exclusion and cohorting, a positive result is going to be your simplest kind of end result of how we're going to deal with that. So these algorithms really kind of address those nuanced concerns when you've got a kid in front of you who's maybe thrown up a few times at school and has a fever, and how to address not only them, but their contacts and their cohort within school. So they do address both.
Okay, and we're sharing this with parents and community leaders, correct?
Absolutely. So it is on our website. I believe the link to the CDPHE website where they are kind of housed is also on there. So they are readily available to not only stakeholders, but the public as well.
Thank you. Great job.
Thank you very much.
Board of Health member, questions for Haley? No? Okay. Thank you. It always amazes me how frequently our health department comes up with policy innovation that helps inform the state's response. I just think that's excellent. I love that. Thank you.
It's definitely a point of pride, so.
Yeah, well done.
Thank you.
Thank you, Haley. And now we'll go to the update on the data dashboard with our Chief Scientific Data Strategist, Stephen Goodwin.
Good morning. It's a pleasure to see you again. Last time we were here, let's see if I can get to the data dashboard first of all. Again, welcome. I'm pleased to be here to be able to talk to you, and what I'd like to do is update you on our data dashboard changes. We're pleased to have just introduced the third major release of the dashboard, and thanks to everybody not only in the data and analytics office, but also communications, communicable disease, to help make this product possible. I think I'll just start with the first page and talk about some of the changes that we've made to the page. The very first thing is that you'll notice there's a splash of color on the page. And what we've done is we've tried to bring a little bit of the here and now to this page. It's a summary page. It shows you the full history. And previously, you could move the dates in order to, for instance, if you wanted to look at how we're doing in the month of August, you could simply move to the month of August and see during the month of August what's actually gone on. Now, the color coding here is significant. What we've done is we've pulled out this concept of active or recent cases. This is a time-based algorithm for determining what are the active cases, since that's one of the major indicators of the presence of the virus in our community. And now, the really interesting thing is that everyone is categorized, the cases are categorized into these 4 present categories. So if I hit active, it highlights active. If I hit hospitalized, it highlights hospitalized. If I hit deceased, it highlights deceased. And you can see all the cards react across the top, and everything is reactive. All the cards across the top and all the pop-ups across the top also react. So it gives people a lot more opportunity to explore the data. And I should say on this page, all of the dates involved, and this is a little bit hard to sort of wrap your head around, but all of the dates involved, with the exception of tests, are the case reported date. So all these dates are the case reported date, and for tests, those are the time that the test is actually reported, not that the specimen is collected. And you can see all the cards are in fact responsive. The other major change, and we're putting a lot of effort into this and responding to the community, which by the way has been marvelous at giving us recommendations and suggestions, very insightful comments, is that every page has a hover over, 2 hover-overs. One is at the bottom of the page that tells you effectively the story of the page and why you're looking at the page, what it's telling you. And at the top of each page, just below our logo, is actually a detailed instruction page. So if you move to that page, it gives you an overview, sort of a photocopy, if you will, a screenshot of the page with instructions that we're continually modifying as we respond to questions, because we fully understand this is very hard data, very difficult to navigate and understand. So we're taking the questions that we get and refining these instructions. Also, I should say the rolling average is a very valuable construct here, and we default it to a 14-day rolling average, but it is adjustable by the user. So you can see anytime we're dealing with data that are changing and they're moving around a lot every day, the rolling average is our friend. Now, looking at the trend here, I'm very, very happy. Last time we were here, we were on the upswing after the 4th of July and before the mask mandate had come into place. And you can see that since that time, the number of new cases that we actually detected, and we always remember that we're only detecting a fraction of the cases that are actually out there, but the new cases have since slowed and declined and decelerated. So you can see now that we're actually moving very nicely in the right direction. And if I could, let me just move to the one page that we have right now that is one of the state metrics, and that is the new case incidence page. So again, this page is not new. We've had this page in the past. What is new is now the hover over actually shows you both the rate in terms of new cases per 100K over the last 14 days, but also actually the raw count of cases. And across, again, the top, you can see in the last 14 days, we've had 621 cases. Again, there are popovers to help you sort of maneuver and understand how we're doing in the last week, the last 3 days, or even yesterday as compared to previous days. days. So the news is good, that we've been definitely moving in the right direction. We've broken back through last week that high level threshold, and we're now down. We were very high, now we're actually high, and we're moving downward. We continue to move downward. So that's pretty fantastic news. And again, this is all based on case reported date. Very quickly, just to go through some of the pages, this page is actually one of my favorite pages, and it is a page that causes a bit of confusion. The dates on this page, so what we do is on a single page now, we show you all of the facts, and this is the one page where we change the dates. So on this page, the case reported date is across the top. On the bottom is the test reported date. We've seen that before. But we have two new bits of information here. The hospitalization are actually the dates of admission. So there's a very subtle difference. If you look, for instance, on so far this month, how many cases have resulted in hospitalizations versus how many people have been admitted to the hospital. They're two different things. And the same thing is true of deaths. By the way, one thing that's very nice about this page for people to understand, one of the challenges with the disease is inertia and lag times. And this page shows very nicely, if you see at the very beginning of our upward trend in mid-June, and then you can sort of draw the mouse down at an angle, and you can see that hospitalizations biologically lag case identification, and deaths lag both, really longer in time. So that's actually a very, very nice illustration of that. And again, this page, you can move the date range around. It's a little bit of a stylized display, but by interacting with the display, you can actually understand a little bit more what you're looking at. And the colors are indicative. The low points are in the time range are in green or blue-green, and the high points are in orange. Really quickly, just moving through some of the other pages, we've seriously amped up the demographics page, and we now have two demographics page because this is, again, very frequently asked. Previous to this, we allowed you to explore sex and age groups, and now we add to that ethnicity and race. And again, by exploring on this page, we've also added hospitalizations, if a case has been hospitalized during the course of their COVID experience, and those who have deceased. And you can see, again, same sort of thing. You can change the date, you can interact, for instance, with the graphic, and you can, just by visual inspection, you can actually see the numbers. So this is a very valuable page for people to explore the demographics of COVID within El Paso County. We've also, this is actually an asked for feature, and what we've done on this page is actually shown you over time, we're actually showing you the demographics. So again, you have age, you have ethnicity, and you have race. So for instance, you can explore over time at a glance, you can see what were the percent of cases that were, for instance, Hispanic or Latino. You can also change the view to month, and you can even dig in and change the view to day if you're so inclined. And by looking at the cases, hospitalizations, and death across the top, you can explore the information. Now, this type of visualization is known as a 100% graph, and it's very useful for the purpose that it serves here, but you have to be cautious. And for instance, if I go over that one area, you can see that was actually only one case. So naturally there it was 100%. But if you move your mouse across the other periods of time, you can actually count the different bands and have a better sense of the magnitude. And also remember that same phenomena of the most recent week will only be partially populated with information. But this is a nice way, again, to look over time at the different changes. And you can actually select multiple, things by holding down a control or a command key, depending on the operating system that you're using. So it's kind of a nice feature. This is the most popular page, I have to confess. I'm not sure why it is, but it truly is. So we added quite a few features here. We actually, one thing we did remove is we removed the rates, because now we actually give you a time slider. So if you want to see in the last couple of weeks how we're doing, you can now look across, and again, the same features are here. You can look over a zip code and see how many cases, for instance, in this case, from 7/31 to 8/25. A feature that was asked for, we have to add some better instructions, but you can take away congregate living facilities, because congregate living facilities, of course, change. Those are facilities like long-term care or dormitories, and they're going to bump the rates up in certain localities. You can also now go to tests, and same thing, you can look at PCR test results on the maps. This is now looking over all time for PCR test results by zip code. And remember, these are the test results that come back to us from the state of Colorado. Again, if you look at a short period of time, the table now has a very nice pop-up feature where you can actually go over and look within a zip code, and you can see how many tests have been executed, the positive tests, negative tests, et cetera, and how many cases have been erupted in that space. Finally, the testing page, just really quickly, one of my favorite changes is the testing page now provides a nice little 14-day positivity run, because positivity is one of those indicators for us. And you can see we're trending in the right direction. We're actually doing quite well. And the card beneath shows that we're now at, in the last 14 days, an average of 3.7% positivity, which is great. That brings us below the threshold level of 5%, which is our goal moving forward. And again, this page is also responsive to the date selected positivity changes, and the cards change as you go. So once again, we have a rolling average, so you can see that average represents the number of tests we're actually executing in the community. So with that, I'd be happy to answer any questions. We have a lot of changes coming up. The next change will be a very asked for feature is how is COVID impacting our area hospitals? And we've gone through a process of working with our hospitals to give us information about the number of COVID or COVID-related cases in the hospitals. And we expect to be able to display that shortly. We're just waiting for the last historic data for that. And then after that, as the state of Colorado sort of refines the metrics associated with Protect Our Neighbors and Safer at Home, we'll be able to display a top page that gives you those metrics at a glance and explains to you the significance of the metrics that the state is tracking.
Stephen, this is fantastic. I'm sorry.
Stephen.
Go ahead.
Dr. Turbish, I would like just to pause just sure. For questions, if that's okay. And we have District 2 Superintendent on the phone that wanted to say a few words about the school COVID prevention response. If we can go to him, and then we'll come back to Stephen.
Thank you very much. I just, one moment.
We can hear you.
Just wanted to make certain that, great. I wanted to compliment the El Paso County Health Department because they're instrumental in allowing us to open schools the way we have. They were first and foremost able to come up in July with some specific lines for us, which the state did not come forward with. They walked hand in hand with the regional superintendents, talking with us about the needs and how we might be able to open our schools. They've been very supportive all along, answering questions. We were among the first schools to open, bringing our K-5 back in Harrison School District 2. We had one K, and I have to say that the County Health Department walked hand in hand with us as we went through the flow charts of how to determine what their reaction would be. But without their guidance, we would have just been on our own as superintendents to make decisions as to how to reopen. They've allowed us to provide in-person education where possible, to make the decision to go remote if needed. But very specifically, they were willing to step forward and do something that had not come from the state or any other agency and help walk us through these decisions. So I just want to make certain that you knew that they'd done this really fine job of keeping us informed and helping us as we work through these difficult decisions.
Thank you so much. We appreciate you standing by and taking the time to provide that feedback. Greatly appreciate it. And we look to forward to continuing our work together.
Yes, thank you very much. I appreciate you being with us today and your kind words. Stephen, you're still on the docket here. Any Board of Health member questions for Stephen? Just a quick comment. Your page is the first thing I check in the morning, and really enjoy it. I think it's incredibly powerful. There's obviously a huge amount of work machinery, if you will, going on behind the scenes, and I think it's very user-friendly as well. So thank you.
Thanks very much. We're always trying to improve it, and there are a lot of people behind it. There's a lot of work that goes into grooming the information and making it available to us.
As always, behind the curtain. Yeah, a lot going on. Okay.
Dr. Turbush, may I ask Stephen a question? Stephen, could you talk a little bit about the work that we've been doing with hospital leadership and how close we are to providing a data dashboard in partnership with the hospitals to provide more insight into hospitalized status?
Absolutely. So in fact, one of the indicators that we're responsible to look at is how is COVID impacting our hospital. So the first and most obvious indicator is the number of cases that we detect. The second is the test positivity. But the third is the rate of hospitalizations. And we can represent the rate of hospitalizations of our own cases, but we don't know how COVID is impacting the hospital. So we need to go to the hospital partners to speak on that. And they've been very gracious. We've gotten all the hospital systems to agree, both in principle and exactly on paper, that they're going to provide for us information that will tell us their daily COVID-related hospitalization count and an assessment of the impact of COVID on their hospital system, whether that be green, yellow, orange, et cetera. So we've gone through the process of building a visualization for that. It's actually in the can ready to display, and we have data now from the hospital systems -1 for the historical data. So as soon as that data comes across, we'll be putting that up, and we hope that'll be any day now. Could be this evening, could be in a couple days, but we're very excited to do that because that's a new step forward. And again, this is information that is really hospital information, hospital knowledge that they're allowing us to display for public use. So it's fantastic.
Thank you. And we are also working with the hospital's communication directors or public information officers to do an announcement when the new feature will be available publicly.
Yeah, and it is a little confusing. I do want to say that our hospitals are, regional centers, so that we're accepting patients from all over the area in Colorado as well as out of state. So we don't even have access to the information that the hospitals can provide. So it's a really nice feature for us to be able to provide that service.
Yes, Vicki.
Steve, I have a question for you. With all of the concern of folks going back to college, have we looked at tracking those numbers from UCCS, Pikes Peak Community College, the Air Force Academy, and Colorado College?
Yes, I would say that as cases accrue and information accrues generally as a reportable disease, obviously, or of course, we'll be able to track that, and we'd be able to track some of the demographics. Some of them, if they in fact become outbreaks, will be tracked as outbreaks. But you're right that one of the risks we're taking moving into the future now, of course, is that we are coming back together, we're congregating, we're going back to school. Also, the weather change, the fall, as the fall and winter arrive, it means we'll be going inside, which increases the opportunity for transmission. So.
Thank you.
As we focused on K through 12 today, I did want to let everyone know that we are in partnership with higher education, and we are in communication with them on a weekly basis as well. So we kind of keep tabs on the different, whether it's UCCS or CC or Air Force Academy, and so we're in close communication and also providing technical assistance to those schools.
And colleges across the nation are in the news due to their social activities. So.
Carr, you had a question?
I do, thanks. I actually have a question about morbidity, and because I'm starting to, if you look at the data, which is wonderful and amazing, and I really appreciate it. Deaths and hospitalizations are relatively low, but we're starting to hear more and more about illnesses that are just lasting months and months, and I know we're still very new into this pandemic, but is that being tracked, or are we seeing any of that data coming through at any point?
You're exactly correct. I mean, first of all, that's a very significant concern. So people early on just focus on deaths and death rates, and haven't thought much about or are concerned much about morbidity. Now, obviously, hospitalizations are an indication of serious illness, but you're precisely correct that we're learning more about this disease now. and understanding that some people have a longer-term effects. And of course, we don't know the longer-term effects of this disease since it's a novel disease. And I don't know if one of our physicians wants to speak to that, but I do think information is developing generally about that, and we'll be attempting to gather that information for local purposes as well.
Dr. Johnson, did you want to address that question?
I always seem to have questions for Dr. Johnson.
By the way, thanks for mentioning that. That's one of the sort of dark areas that people aren't paying attention to.
Thank you.
Morning. That actually is a concern that Stephen and I discuss, and we're pulling articles and looking at all of that data as it comes forward. Obviously, long-term consequences take time for us to understand, and how long that actually lingers, those long hauler cases, and then some of the morbidity that we see in our pediatrics with Kawasaki's. There's, some of the neurologic, and then just the impact on our mental and behavioral health. One of the things around the data points, though, is that this is really hard, I think, in many ways to track, because those individuals don't necessarily congregate into a single portal. So they wouldn't come through necessarily our hospitals if there's lingering symptomology. They're not necessarily just going through their PCP. They may be, if they're having chronic shortness of breath, go to a pulmonologist. And so how we are able to pull all of that data is more complex, and I think speaks to some of the insight that our leadership has had in having data and analytics in office, where we are developing MOUs across the community to be able to compile some of this data in more meaningful ways. There certainly is a lot of work to be doing in that, but it's a very important aspect that we are going to need to track.
Thank you.
Did you say there was another question? Or
No, I just always seem to have questions for
Absolutely.
you.
Thank you.
Thank you, Dr. Johnson. Lisa Powell, who is our... Okay.
Council member?
Go ahead.
Avilia, would you like to speak?
I didn't have a question. It was about the hospitalizations, and was partly answered because they're regional hospitals. But what comes up on council a lot is like, where are the people from? Is there like categories of data for who's hospitalized, like if they're from Payton or Falcon or Monument, or even outside of the county? Is there that kind of information? Because we're always wondering if it's like from here in Colorado Springs. So that was my question for Stephen.
That's a great question. Again, that's information that we would have to get from our hospital partners. Our present product that we've got planned doesn't display where the patients are coming from. It just displays the total COVID impact and the overall assessment. But that's a great idea for future erudition, since the hospital system does have a larger catchment area than simply El Paso County.
Good.
The question around hospital data and the complexities of that is not only are we regional hospitals, but our hospitals operate as a system. So they go up and down the Front Range. And so as they're looking at their census and they're giving us their red, yellow, orange rating, they're looking not only at their own internal numbers, but the trending in those numbers, and then what is the capacity for caring for all of the health issues within our community. Because we know that we need our hospitals there if we're having chest pain or a stroke or going to deliver a baby or break our femur, right? I mean, we want that capacity to care for the day in, day out needs of our community. And so they are really those experts in how they expand and respond to any kind of emergency. And then that transfer, not only by receiving from the region around us, but if they need to call on their whole system level for doing that. And so these are some of those complexities that we really lean into their expertise and their ability to share, and we have to be really very cognizant of their need to be HIPAA compliant, as well as what that means up and down the range. But those are some really fascinating data points that we talk about and we long for, and we'll continue to work with our partners on developing that more fully.
Thank you. Any other questions from Skype? Here in the room? Lisa, you're up.
How to get back to the slides, actually. There we go. There we go. Great. So I'm Lisa Powell, the Emergency Manager for Public Health, here to talk to you a little bit about testing. So as you're all aware, of course, testing is one of those key points that we rely on in order to have a sense of what's going on in our community. And the ability to get more tests in really gives us that broader picture that we need to see what the burden of disease looks like for us. So I wanted to just highlight a couple of efforts that we've made in the last month. First of all, to talk a little bit about some of the targeted testing that occurred for part of the southeast area in Colorado Springs. We did a pop-up testing site in collaboration with Servicio de la Raza and Tigra FM at the YMCA, the Southeast YMCA. It was a collaboration that happened during the time that they were offering a food drive at that site on Mondays. So starting at the end of June through last Monday, August 17th, we put up a testing site in sort of coordinated at the same time as the food drive was going on to be able to collect samples for a couple of hours each Monday during that time frame. We were able to collect 100 samples during that time frame and had an overall positivity rate of 27%, which is fairly significant if you think about what that really means for the kind of work that we need to continue to do for that population in that part of town. It was a really good collaboration, and we built a lot of trust in that community, and we hope that we will be able to continue that moving forward. So we have continued to have further conversation with Servicio de la Raza about how to move forward in some more targeted testing capability. Additionally, then, I want to go back to some comments that the board made earlier about how poised this health department was really to be able to do the kind of work that we're doing, and just highlight that the Emergency Preparedness and Response Program has been taken seriously at El Paso County Public Health, and it really is a compliment to the leadership of El Paso County, specifically Susan, who has really pushed forward this agenda over the past few years that has led us to a place where we could train and exercise and
here you go, just back a little bit. There you go.
Yeah, there we go. That we could train and exercise and really look at how to do things quickly when it comes to setting up events like this. So we were tasked as a team on the 6th of August to set up a testing site. We were able to do that and be in route of testing people on August the 11th. So within a 5-day time frame, we set up a physical space at the Citadel, south of the Citadel, or excuse me, of the JCPenney's store in the parking lot, get all of the logistical supplies in place, working with our partners in both the city and the county, as well as the Office of Emergency Management. We're averaging about 300 samples per day. In the first week that we were open, we were able to increase our test collection for El Paso County by 1,000. So the testing site is currently open from 10 to 7 Tuesday through Saturday. We are reviewing our current throughput to see if there's a need to make some shifts or changes in whether those hours are working for our community. And
and we will be also looking at whether we want to partner further with Mako, who is the contractor, to perhaps do some more of that pop-up testing as well, so that we can target our community where we need to have testing available. So again, in the future then, we will be looking at how we can do that additional pop-up testing. We have been approached by school systems about how we can help them with testing, and we will be exploring those options with the school community group that has already been formed that you heard Haley talk about earlier. And then we are also in conversations with state health department about ways that we can continue to pursue the ability to use our own in-house lab to start doing testing in the future. That's what I have for you today. Questions?
Yes.
Thanks, Lisa. So that 27% positive, that's like super concerning. What, I'm assuming you're addressing it, but do we have any, besides, I understand socioeconomic differences, things like that, do we have any clear answers as to why some of our Latino and African American populations are testing, much higher than counterpart whites?
That's a great question. We will continue to be exploring the why in that, but I think that it's a population that we have not targeted well, and they have not had the same amount of access to our testing sites. Specifically for this Latina community that we reached out to, there were numerous undocumented individuals that were not comfortable coming to traditional health services to receive that kind of testing, and so really the partnership with Servacio, where they are a trusted community, and the ability to offer that at a site where they were already going for other services and were already trusting, that made a big difference in our ability to access that community. So now that we've kind of made some movement there, we hope to continue to do that.
Thank you.
Excellent. Any other Board of Health questions for Lisa? How about remotely? No? Thank you.
I just wanted to wrap up a few comments that, El Paso County is not where we want to be. However, we are making a lot of progress. And those that were involved with the mitigation plan, stepping up those efforts, having a high volume, low barrier testing site was one of those aspects. So all of the combined efforts as related to the prevention measures, the stepped up efforts on, with our community, that they really deserve a lot of credit for practicing prevention and all of the guidance from public health, as well as working with the business community, the economic development and chamber. We have a recovery council where we partnered with stepping up teleworking for businesses, as well as we've scaled back our variance from 175 to 100 for indoor capacity. I will let everyone know that the State Health Department, there's currently discussions on changing the framework as it relates to higher thresholds for mitigation plans. What that means to us is that I believe it's just a matter of time before we're going to be allowed to go back to our variance, which allows 175 indoor capacity. And so we're doing, I think, very well on many different fronts related to, our 14-day rolling average. Our incidence, our positivity is below 5%, as well as the hospitalizations are trending down. So El Paso County is we're heading in the right direction.
Good news indeed. Commissioner Bremer?
Thank you. I know early in this, in the pandemic, there was discussion about a testing goal per day or per week, or how close with now the new testing site open, how close are we to that?
Sure. So we planned for a testing capacity at the new site of 750. And we're not at that level, and we had always intended to run the testing site for 2 weeks, reevaluate not only the number of tests we're doing, but the hours, and also, as Lisa had mentioned, that we are exploring different areas of need. The majority of the testing sites are in Colorado Springs, and we're looking also in southeast El Paso County, because those zip codes, or those are some areas where we're seeing some high numbers. So more to come on that as it relates to how that's going to evolve. And I did want to just mention how grateful we are to UC Health Hospital as well as Peak Vista, because they have really stepped up to provide some testing sites for the community. So I would just say that we had I don't know if I'd say it was a goal, but 250 capacity, just knowing that we needed a lot more capacity in El Paso County, and so we'll reevaluate and then make some changes probably, I would say next week, but we would want to communicate that heavily to the community so that they know when they're able to access. And I'm not sure, Lisa, if you mentioned this, but we're seeing between 5 p.m. and 7 p.m. people trickle in, and some of them are lining up at 8:30, so that tells us that we need to readjust those hours. And I will say that although we have the capacity to do 750 tests, we're not being charged for that. We only get charged for what we're doing.
Susan, I just have a really quick question. Has the CDC, the state health department, or our health department come out with a recommendation on testing? Is it everyone should have like a baseline test, or it's only after exposure? How are we communicating that also, if it does exist, to the public?
That's a great question. And I'll go ahead and address that. Really at this point in time, what we're recommending is that people who have symptoms are the ones who get tested. And actually, just this morning, CDC reiterated that that's the direction that they are anticipating people continue to move towards, is that we're not testing asymptomatic individuals. We're not really trying to target that. We really want people to wait until they have symptoms to get tested.
I will say, though, we're not turning anyone away. Although our testing strategy is to test people who have symptoms, we also are prioritizing critical infrastructure, such as law enforcement. And maybe, Lisa, you want to talk a little bit about that. So we're not doing a...
So the most important aspect of the Citadel community-based testing site is that it is a low-barrier testing site. So while we do ask for symptoms in the questionnaire that you fill out, we don't turn anybody away who doesn't have symptoms at that point in time.
Something I don't know if we mentioned, I think that is great, is that the testing turnaround for that new site. I think we missed that.
Yeah, thank you for that. That is also incredibly important. Not only is it important that we're collecting tests, but that we can quickly get the results back so that we can respond appropriately with the rest of our mitigation plan, of course. And so while the testing site has promised us that we would get results within 4 days, we've actually been seeing turnaround times within 1.5, I think, is the average time frame that it takes to get those results back. So that's been fantastic for us.
Excellent.
Okay. Gonzalez.
Anything else? Oh, yes. Remotely?
Thank you. So Susan mentioned that the state might be changing the criteria in terms of this, going back to our variance limits. But under the current policy, again, I think we've gone 5 days in one category below what the previous concern was, and then I think more days on the positive side, the good side of one of the other on the positivity, and then the 14-day. So what was the criteria to go back to a regular variance under the current situation? If we're at 5 days, was it a week? Was it 2 weeks?
14 days.
14 days.
And it was the 14-day average incidence that would have to be out of the high area. When we applied for the variance, we were at 25 cases per 100,000 below. They also, another evaluation is being below 5% testing positivity, as well as whether the hospitals are trending up, stabilized, or trending down. I am in communication with the State Health Department and have expressed the timeline in a request for our county to go back to 175. And since there are some changes that are in discussions that are happening now as it relates to changing some of the metrics and how counties are evaluated, I'm not sure if the state will allow us to go back to 175 before some of the changes are made. Another area that is of concern to us, knowing what happened with the 4th of July, and as it relates to some increased disease transmission activity, we've got Labor Day coming up. And so that's an area where we need to continue highlighting and encouraging prevention measures, because that's a time when, you know, holidays and people gather.
Susan, anything else for the good of the group here? Okay, well, before we go into executive session, we can carve out a little bit of time for public comment. So here's how I'd like to do that. First of all, I'd like to recognize the people who have been waiting remotely to make comments to the Board of Health. None? No one out there? Okay. And any in the room, we need to limit to 3 minutes. And yes, sir, I'm glad you're wearing a mask if you want to approach the podium. Yeah, please let us know who you are and if you're with an organization, who you represent.
Good morning, my name is Jason Jorgensen. I serve on the District 11 School Board, and just wanted to appreciate the new data, wherever the gentleman is, that he love that. I loved how the bars were broken down. I appreciate that a lot. I do appreciate that. I wanted to ask, since Susan had been mentioning some of the next metrics for going to protect your neighbor, I was looking through that just the other day. Are we already kind of ahead of the curve as far as having a mitigation and containment strategy or plan kind of basically built out, or is that something that we're going to have to be reactive to and then further delay us getting our businesses more opened? So that was, I don't know if you can answer that or if it's just something for you to take back to your board to talk about. But businesses are still struggling. Yes, their doors are open, but they're not profitable. They're still struggling. I myself am a business owner. I've gone through 4 babysitters in just this summer. So with the return to learn and everything, it's very complicated and confusing and disheartening for a lot of families. So that was my first question. My second thing, you talked to the 27% positivity rate. I taught in Harrison School District 2 for 10 years. The Latino community is a big family. They love to be by each other. You can tell them all day to stay 6 feet apart, and they're not going to listen to you because they're family, they're familia, and so they love to hug and kiss, and that's, you're never going to get away from that, no matter how strict you try to be with your social distancing efforts. So that's just that culture, and that's why you saw that higher positivity rate in the southeast corner. And I bet if you asked them, they'd probably say, "Oh yeah, we just had a big party or whatever on Sunday." So just how that kind of goes. If you wanted to know that, for the hospital data, I do check the COVID states website. There is currently 137 hospitalized with COVID across the state. I don't know if that's data you're going to pull into the El Paso County's website or not, but I've been looking at that as well. That was around 200 a month ago, so that's trending downward, as you guys mentioned. For 108 hospitals across the state, I'd say that's really quite great as far as numbers go. I'm looking at all this data. I want our kids to be back in school. I want our families to be able to go back to work safely. And I think what we all need to understand is that we're never going to get rid of the coronavirus. It's a novel virus. It's going to keep mutating. It's going to keep generating just like the flu every year does. And as soon as we get around the idea of this virus is going to be here, we can continue to keep doing mitigation efforts and, vitamins and zinc and whatever people are recommending at the time, but we just need to be familiar with this is not going away. We're not going to have an end where we're going to have 0 cases. We're always going to have cases. We're always going to have this virus around, just like we have the flu around. And so as we get into the flu season, I would love for us to make sure that we're delineating flu virus versus COVID, so that we're not attributing flus into our spike in cases and then further setting us back in our variances and things like that. So thank you for your time and for all the work that you do. I appreciate it.
Thank you. Any other public comment? Nope. Okay, well, we're not adjourning. We're going to move into executive session, but as part of that, Board of Health moves into a different room. And board members who are on remotely, I would ask that you join us in executive session. I'm going to read a little bit of a preamble that explains executive session. I'm glad our lawyer is moving forward here. Executive session is pursuant to Colorado Statute 246402, the purchase, acquisition, or lease of real property, and 246402-4E, determining positions relative to matters that may be subject to negotiations, developing strategy for negotiations, and instructing negotiators. Those are all reasons for an executive session. For the purpose of discussing a possible purchase or lease of property in the Fountain Security Whitefield area. And let's see, if they're in the room, I would ask that Todd and Kinney could join us, our lawyer, obviously, and Susan, senior staff, you have picked out a few. Yes, Lori.
Thank you, Mr. Chair. We do need a motion, a second, and a 2/3 vote to approve going into executive session. Yes, sir.
Okay, good. I'm glad you keep us on the straight and narrow here. One rep from Quantum, and Susan, who else needs to go with us?
Lisa Powell, Deanne Ryberg, and Michelle Hewitt, Vicki Bennett.
So those are the senior staff members who, and Brenda Heimbach, is she here?
She might be online.
Okay, well that'll be good. We have the technology to allow that. Okay, well we're going to move into executive session, but we need a motion, a second, and a vote with a 2/3 majority.
Second.
All in favor?
Aye.
Aye.
That sounds like unanimous. So we're going to move into executive session. Thank you, Lauren. Let's take to do that. Let's start again. Okay, pursuant to CRS 246402, the El Paso County Board of Health held an executive session. No decisions were made, no votes were taken, and we will resume our regular Board of Health agenda. And we have a motion to adjourn.
I move that we come out of executive session.
Second.
All in favor?
Aye.
Aye.
Okay. All right, thank you. And we have another aye here. Okay. Looks like we've got, so on the record, Vicki and Dr. Buck, so we have more than a quorum. Okay, this meeting's adjourned.